brought in by her husband.
Hi, my name's Sarah. I'm going to be one of your nurses today. Can you tell me what brings you here?
I just really don't feel good.
She's been losing a lot of weight and she's been very tired. And also she's been very cold and shaky.
Okay. Have you traveled anywhere recently or had any procedures done?
No, we haven't traveled, but I did have some dental work done.
Okay. Well, we're going to go ahead and start an IV on you. Do you have any allergies?
No.
No? Okay. So is it okay if I go ahead and start my assessment?
And then I'm gonna come in.
All right. Hello, Miss Grant. I see you're not feeling so well lately.
No.
You're experiencing lethargy, weight loss, fever. Yeah. With chills. Yeah. Nurse Tara, I will put in the orders for CBC with blood draw or with blood cultures, CRP, ESR, EKG, chest X-ray, and an echocardiogram. As soon as I get the results back, I'll be back in and we'll talk.
After Dr. Lydia assesses the patient and doctor's test, the patient is diagnosed with an infective endocarditis, confirmed by blood cultures and echocardiography.
Hi, my name is Brenda. I'm going to be your nurse for today.
Hi, Brenda.
Hi. Can I verify your name and date of birth?
Alana Grant, 7/11/90.
I understand that you're going to get a PICC placed and you signed your consent, right?
Mm-hmm.
Okay. Do you have any questions for the doctor?
Not right now.
Is this really necessary, Doc?
I understand your concerns for your wife. I assure you that this is our best course of treatment. Due to the extended amount of time that she's gonna have the antibiotics for, we need to place the PICC line to make her more comfortable so she doesn't get multiple pokes for it, and then so you can take her home as well, so she can do this treatment at home. Sound okay?
Sounds okay.
We're going to have a specialized nurse to place the PICC line come in.
Okay.
I reviewed your labs and your tests that we ran, and it looks like we're dealing with infective endocarditis. We'll need to give you antibiotics for prolonged amount of time. So we'll need to place a PICC line to begin your treatment of antibiotics. Let me explain the procedure. We'll place the line in your arm. First, we'll numb the area. You might still feel a little bit of pressure, but that's normal. Then we'll insert a special needle to insert into the vein. And once we're in the vein, we use a guide wire to get the catheter to a larger vein near the heart. So then once we're done placing it, we'll confirm with the chest X-ray and you'll be all set to start antibiotics.
Okay, that sounds better.
Hello,
Hi.
I'm Karen. I'm your PICC nurse. I'm here that you have an order for a placement of a PICC line. So we're going to get that started. I do see that your consent was signed. Do you have any questions?
Not at the moment.
Okay, I'm going to go ahead and get started here. I'm just going to set up all my supplies. Okay, so I'm going to set up the procedure area, and we're all going to be wearing a mask so that we help reduce the risk of an infection. Okay, so I'm going to have you go ahead and place that on, and then I'll give one to you also. Okay, so I'm gonna get my area ready for everything.
Okay.
I'm going to have us wear masks again for the same to prevent infection, okay? And since you're in the room, we're gonna have one placed on you as well, okay?
Mm-hmm.
Or didn't you have to go to work, sweetie?
It's about that time.
Okay, well you can head out. I think I'll be okay.
Okay.
After washing her hands thoroughly with soap and water, she prepares a clean workspace and gathers all supplies. She explains the procedure to the patient to ensure their comfort and understanding.
Line is placed, you did great. Now what we're gonna do is we're gonna take you to x-ray to make sure that the placement is where it needs to be.
Okay.
Hi, how are you doing?
I'm doing okay.
Okay, so it's been 24 hours since your PICC line was placed, and so you're due for a dressing change. Nurse Karen's gonna come change that for you.
Okay.
Do you have any questions?
No.
So how often does this have to be done?
So after it's placed, it gets changed in 24 hours, and then after that, it'll be changed every 7 days.
Okay.
Hello, I'm Karen again.
Hello.
Nice to see you again. It looks like I have an order to change your dressing after the first 24 hours, so I'm gonna go ahead and get all my supplies.
Okie dokie. Nurse Karen dons non-sterile gloves and removes the old dressing. Nurse Karen gently peels off the old dressing while holding the catheter in place with the other hand to avoid pulling it off. She checks the insertion site for signs of infection, redness, swelling, and discharge. She now removes non-sterile gloves and performs hand hygiene again. Nurse Karen is applying sterile gloves and maintains sterility throughout the procedure. While using chlorhexidine swabs, she cleans around the PICC line insertion site. It is important to clean in a back and forth scrubbing motion for at least 30 seconds. Let the area dry completely to reduce infection risk.
Okay, we're just gonna let that dry, and then once that's all set and dry, we're going to apply a new dressing on top.
After the area has been completely dry, she applies a sterile transparent dressing over the insertion site and secures the PICC line, ensuring no gaps or wrinkles. It is important to label the dressing with the date and time of the dressing change and your initials.
All right, that is all set.
She now disposes of all used supplies and gloves in the waste receptacle and performs hand hygiene. Some key consideration is monitor the insertion site for signs of infection, redness, swelling, discharge, and pain. Maintain a sterile environment throughout the procedure to prevent contamination and infection.
So your dressing change went really great. Everything looks like it's healing. Everything looks fine with the skin. I'm gonna go ahead and document that we completed this, and then I'll let Dr. Lydia know, okay?
Okay, thank you.
Thank you.